Hypercholesterolemia is a metabolic disease. Look at this picture, shows that disease mechanism and blockage in arteries, detail going on. Introduction. Hypercholesterolemia refers to elevated levels of cholesterol in the blood, a major risk factor for cardiovascular diseases. Cholesterol, a fat-like substance, is essential for cell membrane structure, hormone production, and bile acids for digestion. However, high cholesterol levels can lead to the buildup of fatty deposits in arteries, causing heart disease, stroke, and other complications. Definition. Hypercholesterolemia is defined as an abnormally high level of cholesterol in the blood. This includes both high, low density lipoprotein cholesterol and total cholesterol levels. Types. 1. Primary hypercholesterolemia. Genetic in nature, often due to inherited conditions like familial hypercholesterolemia. Second, secondary hypercholesterolemia caused by other factors such as lifestyle, underlying medical conditions. 3. Heterozygous familial hypercholesterolemia, inherited from one parent, causing high LDL cholesterol levels. 4. Homozygous familial hypercholesterolemia, inherited from both parents, resulting in extremely high LDL levels. Causes. 1. Genetic factors, mutations in the LDL receptor genes, causing faulty removal of LDL from the blood. 2. Diet, high intake of saturated fats, trans fats, and cholesterol rich foods. 3. Secondary lifestyle, lack of physical activity contributes to high LDL levels. 4. Medical conditions, diabetes, obesity, and hypothyroidism can increase cholesterol. 5. Medication, certain drugs including corticosteroids and antiretroviral may raise cholesterol levels. 6. Smoking and alcohol consumption both contribute to unhealthy cholesterol levels. Risk factors. 1. Family history of hypercholesterolemia, early heart disease. 2. Poor diet rich in saturated and trans fats. 3. Sedentary lifestyle. 4. Obesity or being overweight. 5. Smoking. 6. Age. Risk increases with age. Menopause in women due to hormonal changes. 8. Diabetes and other metabolic conditions. 9. High blood pressure. Complications. 1. Atherosclerosis, plaque buildup in the arteries, narrowing them and reducing blood flow. 2. Coronary artery disease can lead to angina, heart attack or heart failure. 3. Stroke, blockage, rupture of blood vessels in the brain. 4. Peripheral artery disease, narrowed arteries reduce blood flow to the limbs, leading to pain and mobility issue. 5. Chronic kidney disease due to reduced blood flow to the kidney. Pathophysiology. Cholesterol is carried through the bloodstream by lipoproteins. LDL transports cholesterol to cells, but excess LDL leads to deposition in artery walls, causing atheroma, fatty deposits formation. Over time, the atheromas narrow the arteries. It means atherosclerosis, reducing blood flow and leading to cardiovascular events like heart attacks or stroke. HDL cholesterol, often termed good cholesterol, helps remove excess cholesterol from tissues and transports it back to the liver for elimination. Imbalance between LDL and HDL lead to hypercholesterolemia. Step-by-step process. 1. Cholesterol synthesis and circulation. Cholesterol production, lipoproteins. 2. Excess LDL cholesterol in blood. 3. LDL oxidation and endothelial damage. 4. Monocyte activation and cell formation. 5. Formation of fatty streaks. 6. Block formation and growth, atherosclerotic plaque, smooth muscle cells. 7. Narrowing of the arteries, atherosclerosis. 8. Plaque instability and rupture. 9. Thrombosis and complete arterial blocks. 10. Organ damage and complications. Signs and symptoms. Hypercholesterolemia is often referred to a silent condition. It typically presents without symptoms. However, in severe or prolonged cases, signs may be included. First symptom, exanthomas, yellowish deposits of cholesterol beneath the skin or around the eyes. 2. Arcuus sinalis, a white or grey ring around the cornea of the eye. 3. Angina, chest pain due to reduced blood flow to the heart. For leg pain during exercise in cases of peripheral artery disease. Diagnosis: on leaf panel blood test. Measure total cholesterol, LDL, HDL and triglycerides. 2. Normal total cholesterol less than 200 mg per dl. 3. LDL cholesterol less than 100 mg per dl is optimal. For HDL cholesterol above 60 mg per dl is protective. 5. Genetic testing to diagnose familial hypercholesterolemia. 6. Imaging test may include coronary calcium scans or carotid ultrasounds to assess artery health. Nursing diagnosis: 1. Imbalanced nutrition related to excessive intake of cholesterol and fats. 2. Risk for decreased cardiac output due to atherosclerosis. 3. Risk for ineffective tissue perfusion related to reduction blood flow from plaque formation. 4. Anxiety related to the possibility of developing serious cardiovascular diseases. 5. Deficient knowledge regarding hypercholesterolemia and its management. Management: lifestyle changes. 1. Diet: reduced intake of saturated and trans fats, increase fiber and plant-based foods. 2. Exercise: regular physical activity helps lower LDL and raise HDL. 3. Weight loss: reduces LDL and total cholesterol. 4. Quiet smoking and limit alcohol consumption. 5. Monitoring: regular lipid panel tests to track cholesterol levels and treatment efficiency. 6. Patient education on diet, exercise and the importance of medication adherence. Treatment: medications. 1. Statins: lower LDL levels by reducing cholesterol production in the liver. 2. Ezetimibe reduces cholesterol absorption from the intestine. 3. PCSK inhibitors lower LDL by promoting the removal of cholesterol from the blood. 4. Bile acid sequestrants help eliminate cholesterol through bile. 5. Fibrates and niacin can help in cases with high triglycerides. Psychosocial medicine. 1. Emotional support: patient with chronic condition like hypercholesterolemia may experience anxiety or fear of heart disease, requiring emotional support and counseling. 2. Health education: important to alleviate stress and enhance patient understanding of lifestyle modifications. Three social factors address the patient's access to healthy food, exercise, facilities, and support systems. Prevention: one, healthy eating habits, reduce intake of cholesterol and fats to regular physical activities. Aim for at least 150 minutes of moderate aerobic activity per week. 3. Maintain a healthy weight, prevent obesity and related complications. For regular screening, lipid panel should be done periodically, especially for those with risk factors. 5. Manage other conditions. Control diabetes, high blood pressure and other related diseases. In conclusion, hypercholesterolemia is a significant risk factor for cardiovascular diseases. Early diagnosis and management through lifestyle changes, medications, and regular monitoring can help reduce the risk of complications. Preventive strategies facing on healthy eating, regular exercise, and managing risk factors are key to controlling cholesterol levels and improving overall health. Thank you. Have a good day.